Hello and welcome to Intro to Nursing 1 and 2. This year, your course will be co-taught by two professional nurses, Miss Wendy Hudspeth and Miss Yasmin Khan Todd. The best way to reach us is by email, both of which are provided here on this slide. We've also included our personal cell phones. We just ask that you guys be respectful of the fact that these are our personal numbers and to use them only in emergency situations, please. The course standards for Intro to Nursing. This is an occupational preparation course that emphasizes body systems and diseases as they relate to advanced clinical care of the acute medical surgical patient, the chronically ill, and the elderly. Through this class, students will receive skills training and hands-on clinical experience in a healthcare setting. In addition to the didactic portion of this class, we will highlight fundamental nursing skills through hands-on learning in the simulation lab. The nursing simulation lab with our high and low fidelity mannequins will be utilized to provide practical application of skills to progress the students towards an optional 40-hour clinical experience at an assisted living facility. Students who successfully complete the course and the 40-hour clinical experience will be eligible to sit for the Virginia Nurse Aid exam. This is a 2-semester course that follows the requirements needed for evaluation by the National Nurse Aid Assessment Program. The NNAAP exam consists of both a written examination and a skills evaluation demonstration exam. This exam will test the student's ability to understand and safely perform the job on an entry-level nurse aide. As a bonus, Fairfax County Public Schools will actually provide a one-time voucher to cover the cost of the state exam for a student to sit for the exam immediately following completion of this course. As mentioned, the course material is presented in both the classroom and in our nursing simulation lab. The focus of these learnings will be on the direct role that the nurse aide has in providing care for patients and necessary collaboration to interact with other members of a healthcare system to provide optimal care to a variety of patients. Through the didactic and practical portions of this class, in addition to the clinical experience, students will be prepared to take and pass the state exam to become a CNA or Certified Nursing Assistant. The state requires certain competencies or skills to be demonstrated to proficiency prior to the clinical experience and in order to pass the state exam. A generalized overview of these skills are covered in this slide and are listed as competencies. There is also a link at the bottom of the page that can be utilized to view these competencies in their entirety. Each student will be provided with a grading rubric checklist prior to demonstrating the competency so they know each step needed to demonstrate it to proficiency. Students will also have multiple times to demonstrate the competency to proficiency through the semester. A few highlights of the syllabus that I would like to go over and I'd like to reiterate. Students who wish to take the state exam must participate in the 40-hour clinical experience at an assisted living facility set up through West Potomac Academy and Fairfax County Public Schools. However, this clinical experience is not required for students who do not wish to take the exam, and their grade will not be affected if they do not take the exam or sit for the clinical experience. If a student wishes to take the state exam, they must have an 80% or higher in the class to be eligible to sit for the exam. Fairfax County is operating on a rolling gradebook, and our class will try to accommodate that as much as possible. Certain work needs to be reviewed in class to ensure knowledge prior to moving on to the next skill or unit, and any work submitted after its deadline that is reviewed in class will not receive credit. However, all work not requiring review in class will have the ability to be submitted at the student's leisure. In addition, all of the competencies will have the ability to be demonstrated multiple times until the student is satisfied with their grade in that semester. And this brings us to our last topic, which is the grading rubric. West Potomac High School is now operating on a 4.0 grading scale. In this slide, you will see that I've put together a percentage to help students understand how the 4.0 grading scale will be utilized and initiated. Each assignment will also have a scale following this breakdown provided to the students so they know what is required of them. A 4.0 will equate to a 90 to 100%, and it means that the student is consistently demonstrating accurate and complete knowledge of a skill. 3.0 is an 80 to an 89%, and that demonstrates knowledge of a skill with some areas for improvement available. 2.0 is 70 to 79%, and it demonstrates knowledge of a skill with many areas for improvement needed, and therefore additional practice is also required. 1.0 is 60 to 69%, and it demonstrates a significant need for practice to acquire the skill. A 0 demonstrates the skill was either not performed at all or done in a way that did not even demonstrate basic knowledge of a skill. We are not anticipating anyone to receive a 0 or a 1. We're hoping for a great school year with active engagement and critical thinking. Please feel free to reach out to us if you have any questions, and we're looking for a wonderful year.